Hello and welcome. You're watching NDTV 24/7. I'm Rishika Barwa. The second wave of coronavirus in India is waning, but there is a threat of an inevitable third wave that is looming. A new Delta Plus variant is spreading across the country. Will our strategy, our treatment, our vaccines work against it? Also, to answer the million-dollar question on just how prepared is India for a third wave of COVID, Dr Randeep Guleria, the head of AIIMS, joins us on the broadcast. Thanks so much, Dr Guleria, for speaking with NDTV. I have to begin by asking you about the big story that we've been tracking, which is the controversy between the centre and the AAP government. Did Delhi exaggerate the demand for oxygen in the second wave of COVID? Two members of the 5-member audit subgroup, which was led by you, have dissented. Where do you stand?
So I think the report has been submitted to the Supreme Court, and it's an interim report, so one should wait for the final report to come. Until the final report comes, it's difficult to really say one way or the other. And in my mind, we should really see how we can prepare for the future and what lessons we can learn from the past, rather than really trying to dwell upon things which have happened. We should see how we can improve as far as the future is concerned.
Right, but the interim report does suggest that there was an exaggeration as much as 4 times?
I don't think we could say that. I think the issue here is basically that we need to look at what is available. It's a supply-demand issue, and we need to balance that out.
Right. Doctor, the reason I'm asking you this question is because a lot has been talked about in the last 24 hours about the formula for calculation. Now, Delhi's oxygen demand was calculated on the basis of active cases. At least that's what we're hearing. Could therefore, an undercounting of the active cases, which is possible in the peak of the second wave, affect this assessment?
So there can be multiple factors. This could be one. There could be other factors also. And that's why, like I said, we need to see how we can do a more reasonable evaluation and see how things can be looked at in the times to come, so that we are better prepared for coming waves.
Right. You've warned about the inevitability of a third wave in the country. You said to us last week it could be coming as soon as 6 to 8 weeks if COVID-appropriate behavior is not followed. Do we, therefore, as a country, have an accurate assessment of the oxygen demand, the drug supply that is needed to prepare for a third wave? Have we learnt enough from the second wave, done those assessments to be better prepared for a third wave?
I think so. I think a lot of work has gone on, and we have had a large number of groups in the government which are working, and therefore both in terms of the need for oxygen, the need for drugs, the need for more beds. And remember, there was this whole issue that we may have more pediatric children, pediatric age group children that may be involved. That was also raised. Although I don't feel that there is data to support that. But even keeping that in mind, preparations have been made that in case you need, let's say, masks or other medication for the young children, we should have those also ready. And that type of work has also been done. So I think we have learned from the first and second wave, and one is ready for any future waves. Remember, this is going to be a moving pandemic, so you have to really plan from that point of view. As cases increase in one area, you have to focus on that area, and as the pandemic moves to other areas, you will need to focus on other areas.
Right, and you have in the past as well stressed on the need for hyper-local strategies in dealing with the containment of the spread. The other big question, therefore, that comes to mind when you talk about the inevitability of the third wave is, will it be more severe than the second?
Again, there are a lot of debates on this. My own assessment is that unlikely that it will be more severe for 2 or 3 reasons. But the first reason is that currently data does not support that the circulating strain is causing more severe disease in terms of causing more deaths, more hospitalization. Secondly, we have a large number of individuals who have already got the infection, whether they have been symptomatic or asymptomatic, and therefore there is some degree of immunity which many people have, and the vaccine is also being rolled out. So my own feeling is that the subsequent wave will not be as bad as the second wave. We probably have come out of the worst, and now we should try and minimize the future waves by having COVID-appropriate behavior, very good surveillance, and really trying to push for vaccination as much as we can.
Well, we sincerely hope that your assessment is correct and the worst is indeed over. Dr. Guleria, I want to just shift our focus then to the other cause of concern, which is the Delta Plus variant. Now, one of the reasons why this is creating, more questions and a lot of insecurity among people is because little is known of it. Could the Delta Plus variant have the potential to cause a third wave?
So one is very closely monitoring that. Currently, the data suggests that the Delta Plus variant still has not become the dominant variant, and the Delta variant is still the dominant variant. But we are gradually seeing an increase in number of cases in various parts of the country as far as the Delta Plus variant is concerned. And therefore, it needs very close monitoring. We should not be caught off guard because we know that suddenly the virus can become very infectious. And as we saw in the second wave, it can really lead to a huge spike in the number of cases. Therefore, very good surveillance is required from the point of view of seeing wherever your case positivity rate is going up, and a lot of aggressive testing as far as genome sequencing is concerned to pick up the variant and get an idea of how it is behaving in our population.
Right. And when we talk about, protection, vaccines giving us protection against, a more severe third wave, could the 12 to 16 week dosing gap, and I'm coming back to this again, could that diminish? Could that reduce the protection that vaccinated individuals have?
So I think at a given point in time, and based on the data that was available then, 12 to 16 gap was an ideal time for the second dose because of the fact that it gave the first shot gave good immunity, and taking the booster shot after 12 weeks gave much better immunity than taking it earlier. But I agree that this was when you had a different variant which was circulating. And if the variants change and they can lead to a different mechanism, and the protection by the first shot is less, then it is worthwhile to look at whether you need to change your policy or not. I'm sure this is being looked at because nothing is definite. The pandemic has taught us this, that you will need to change as the virus evolves. What we had done initially with the AstraZeneca vaccine was a 4 to 6 duration. Then it went up to 8 weeks. Then it went up to 12 weeks. So there is no definition thing that it will stay at 12 weeks. It can still come down depending on the literature and the science that evolves.
But the science does tend to support that 2 doses give you better protection. Do we therefore have lesser protection, those of us who are vaccinated with 1 dose, waiting now for that extended time gap to get our second dose?
So that's exactly the point. We need to look at the data, and if the data is robust enough and the expert group feels that it is worthwhile, then we can decrease the dose. This is something that can be done. It's not that 12 weeks is permanent. And I think the aim should be that we should give the best protection to our citizens based on the science that is available at that point in time.
The Public Health England study, Dr. Guleria, said that the vaccine 1 dose of the AstraZeneca vaccine could give you just 30% protection against the Delta variant. Does that worry you?
It is a cause of concern because it does show that the prime dose itself may not give that much of protection, and you definitely need a booster dose, and you may probably need it earlier than later. But we need to have robust data, and based on that, I'm sure the experts will look into it, and if there is a need, then the duration will change. Okay. And that will happen as we move along this pandemic as far as vaccines are concerned.
Well, shifting focus from vaccines to treatment protocols, will the existing treatment protocols in place work against this Delta Plus variant?
So as of now, whatever data we have suggests that whether it be steroids, whether it be the other drugs that we're using, anticoagulants, they are standard treatments and they will work against any of the new emerging variants that we have. There is some debate as far as the monoclonal antibodies are concerned, because these antibodies are basically working against the previous strains, and will they be effective against these new mutations which have happened? Some data which is emerging suggests that they will still be effective. The efficacy may come down. So I would say broadly, the current treatment strategies will work as far as the new variants are concerned.
Right. And will our vaccines work against the Delta Plus variant? We know that there is already reports of diminished efficacy against the Delta variant. What more is known about the efficacy against the Delta Plus?
So 2 things there. One is we need to get more data as far as Delta Plus is concerned, because we still have very few cases, and to say whether the vaccine is working or not, we will need a larger database to really answer that question in a comprehensive manner. But if we look at the current cases that we've had, it does suggest that as far as severe disease is concerned, hospitalization, dying because of COVID, the vaccines are still protecting us. They may still not protect us as much as we would want from getting the infection. So if you are coming in, if you've been vaccinated and you come in contact with a person who has COVID, you could get the infection. But the vaccine, the antibodies produced by the vaccine will not allow you to get a severe infection requiring hospitalization, and you will not die because of COVID-19. So the vaccines protect you against severe disease. The protection against infection may come down to some extent.
All right. Well, moving on to the other big development which has taken place, which is the fact that the government has now said that pregnant women must go out and get themselves vaccinated. The question, therefore, that many are asking is which vaccine currently available in India is best suited for pregnant women?
So I think this is something that is overdue, because there is now a lot of evidence emerging that vaccines are safe for pregnant women, and we must protect pregnant women also. It's protecting both the mother and the fetus. So it's important that we give vaccines to pregnant women. The only issue has been the safety. And the data that is now emerging suggests that both vaccines are safe. The Covaxin is based on on a standard platform for which many vaccines which are given to pregnant women are used on. The same platform is used, so it is safe. And even the data which is emerging as far as the Covishield is concerned is that it is safe. So I feel that we should roll out the program of vaccinating pregnant women as we did for lactating mothers.
The reason I ask this question is because predominantly wherever pregnant women are being vaccinated globally, predominantly they are being given the Pfizer vaccine, which isn't yet available in India. So should pregnant women, in your opinion, wait for the Pfizer vaccine, which is relatively more tried and tested, or should they go ahead and get the Covishield, Covaxin or the Sputnik?
So the data that is there, published data, is definitely there for the mRNA vaccine, that is the Pfizer vaccine.
Yes.
The data, if you want the pure data, let's say from the science point of view, the data from the other vaccine is not there as of now. But a lot of data is extrapolated. You cannot do a large study on pregnant women and then look at the safety of vaccine. And therefore, you will have to extrapolate data and take what we call a risk-benefit analysis. So currently, based on the extrapolated data and the risk-benefit analysis, it seems that all vaccines should be safe and we should give them to pregnant women, so that we can prevent both the mother and the baby.
All right. Well, I want to, also shift our focus to the other interesting development that we've been tracking, which is on vaccine mixing. Dr. Guleria, the second dose of AstraZeneca is no longer recommended in Canada. Those who've got the first dose of AstraZeneca are being recommended to take an mRNA vaccine as the second dose. Is AstraZeneca or Covishield, like it's known here in India, followed by a Pfizer or Moderna vaccine better?
So this is something that is being looked at. It's been looked at in the past, known as a heterologous prime boost, that you give a heterologous, that is a different vaccine as the priming vaccine and a different vaccine as the booster vaccine. This has been tried and shown to be effective even as far as the Ebola vaccine is concerned. And there are studies which have looked at it directly or indirectly. There are studies in the UK which have looked at AstraZeneca followed by the Pfizer vaccine, or AstraZeneca followed by the Sputnik vaccine. And studies from Spain where for some time, the AstraZeneca vaccine was not given because of the fear of side effects, and subsequently Pfizer vaccine was given. The data that is available suggests that the vaccine is more reactogenic. It does lead to a little bit higher side effects if you mix the vaccine in terms of fever and other immune response. But there is also some data which suggests that it may lead to better immunity or better antibody production. I think we need more data. But this is something that can happen in the future, that you may be able to mix and match your vaccines. It will also give us the advantage that then you could use your vaccines in a better manner in terms of the doses that you have for the general population. But one needs to have the more data, because remember, there are a large number of vaccines which are available or will be available in the future. It's not only the AstraZeneca, you will have Pfizer, you will have Moderna, you will have Sputnik, you will have the Zydus Cadella vaccine, and you will have other vaccines also coming in. And therefore, which combination is better is something that we really don't know. Is it AstraZeneca with Pfizer, or is it AstraZeneca with Moderna, or is it with Sputnik, or is it Covaxin with any of the others? So I think we really need to get the data there. But yes, initial studies do suggest that this may be something that can be tried and may be useful.
One factor is, of course, better immune response. It's been talked about, but there's also concerns over the fact that if you mix two vaccines, they could lead to more side effects. So I think both sides of the story there need to be looked at. But if we just look at vaccine shortage, which has been one of the biggest causes of concern in India, do you think logistically it would make it easier if India was to go ahead and adopt this vaccine mixing strategy as well?
Logistically, it will definitely be easier because we have much more doses of Covishield as compared to Covaxin. And when we have other vaccines coming in, they would be in a different ratio. So Sputnik would be at a lesser ratio, or let's say Pfizer, the numbers would be less. And if we could do that, then we would be able to really give more logistically, it would be easier to do. But the challenge is that we have to be really careful, as like you said, the side effects, or like you mentioned, the reactogenicity, that the mixing of the two vaccines should be safe. It should not cause more side effects. And there should be enough data to suggest that it is actually worthwhile and it is actually giving better immunity in the long run.
All right. So, well, that's going to be something interesting to watch out for, whether or not India does adopt that strategy. We're going to slip into a very short break. We have a lot more questions lined up for Dr. Guleria. Do stay tuned. Welcome back. We're in conversation with Dr. Guleria. Dr. Guleria, the Pfizer vaccine does present a lot of hope for India, whether it is, Pfizer that's being given to pregnant women. Data suggests that it's good for pregnant women, or the fact that it's being given to younger children. By when can we expect the Pfizer vaccine in India?
So one is hopeful that this will happen soon because now there is a lot of talk between the government and the company in terms of the issues that they had in bringing the vaccine to India. The government of India already has given the waiver that you don't need to do bridging studies, and if it is approved by the FDA, Pfizer would be approved by the Indian regulatory authorities. So I think once the company is comfortable bringing it here as compared to with the discussion with the government, we should be able to get it. But I think we should keep in mind two or three things. One is, yes, the Pfizer would be useful for giving it to children and pregnant women because there is safety data. But in absolute numbers, the doses will still not be as many as we need. And we will still need to rely on the vaccines which are being made in India, that is the Covishield and Covaxin. So this will add on to our vaccine numbers if we get it, and that will be a good thing. But we have to really see how we can boost the production of vaccines which are being made in India, because they are our sort of backbone in terms of the vaccines that we need for our citizens.
Right. And, India's daily vaccination target has been below what we need it to be in order to be able to achieve the government's own target, which is vaccinating most of our population by the end of this year. What do you think needs to be done at this juncture when we're preparing for the possibility of a third wave to enhance and boost our vaccination drive?
So I think we are now in a state where we will have reasonably enough vaccine doses. So the issue of shortage of vaccines availability will gradually become less and less, especially as we move into the later part of July. The issue that we need to do is develop strategies so that at every level there is good vaccine delivery and distribution, so that even all areas can get vaccine, and we can increase our vaccine to all the vaccine shots to almost 1 crore a day. And that means that we have to develop more vaccination sites, look at different strategies in different areas, whether it be urban, rural or remote parts, so that we can reach out to citizens and give them the vaccine. One could hold vaccine camps, one could develop a strategy where it could be done on a, let's say, door-to-door basis using a mobile system or some other mechanism, so that more and more people are vaccinated like we've done in the past. And we have a lot of experience for this as far as the polio vaccination is concerned or other mass vaccination drives are concerned. Learning from that experience, I think we should try and do this in a very aggressive manner.
Right. I want to just also shift our focus once again to the state of Maharashtra, which is already witnessing a slight slow but steady rise in the number of cases in the past week. This is a worrying trend. Now, I don't, it's still meant to be answered whether one can make a connection between the fact that this is the state that is reporting the maximum number of Delta plus cases and is seeing a slow, steady rise. Would you make that connection just yet?
Currently, it's difficult to make the connection because you have to see that those areas where you're seeing a rise, are they linked to more and more Delta plus cases being reported in that area? That unless you can make that connection and you can sort of connect the dots, it's going to be difficult to say that this is related to Delta plus. I mean, in my mind, it is more related to lack of COVID appropriate behavior because of unlocking that is happening. There is a lot of crowds developing. People have started mixing a lot without COVID appropriate behavior. And as the number of cases come down, people become more lax, and then the virus is still around, and this leads to a surge in number of cases. The challenge here is that we need to stop it right now rather than letting it become out of control and then having a huge increase in the number of cases. So containment, aggressive COVID appropriate behavior, very good surveillance so that it doesn't increase, and like you said, looking for what is the variant, is there a new variant which is causing this, are all things that we need to look at.
When it comes to virus mutations, there has been a trend that they are mostly first observed in Maharashtra. This is also the state that first begins to witness a surge in cases, and then there's sort of a ripple effect felt elsewhere. Why is this state more vulnerable, or is it more vulnerable?
So this is something that we saw in the second wave. I'm not sure whether this is just a coincidence or this is something to do with the crowding out there or let's say more of mixing that happens. But last time also, the initial cases and the mutation that happened did happen in the state of Maharashtra. I think it's more of a coincidence, but I think it's something that we need to monitor very closely because a slight surge should raise a red flag, and we should sort of counter it early rather than waiting for it to spread to other parts of the country.
Right. But in areas, in districts where Delta plus is being found, do you believe that a containment strategy needs to be put in place? Do these districts need to go into a lockdown?
So any area, whether there is Delta plus or you're just finding a surge of cases, because remember, you are not going to be able to test everyone.
Yes.
So you are doing a limited sampling. So any area where you find that your positivity rate is going up, let's say it is more than 5%, you should have a containment area or a mini lockdown in that area. Because otherwise your cases will again start going out of control and you will start having another surge. So we should not wait for seeing whether this is Delta plus or this is Delta. Any area where you're finding more cases happening, your positivity rate is going more than 5%, you're finding that more than 50 or 60% of your COVID beds are suddenly getting filled up by patients, that should be the red flag to really have a lockdown in that area so that you don't allow the cases to increase.
Well, important that lockdowns need to also be put in place as preemptive measures and not just as corrective measures. Thanks so much, Dr. Guleria, for sparing your time and being with us on NDTV.
Thank you. Thank you.